Assalamualaikum warahmatullahi wabarakatuh. 87,6 MHz Radio DFM, saluran edukasi berkarakter. Alhamdulillah, salatu wassalamu ala rasulillah wa ala alihi wa sahbihi wa man wala. Asyhadu an la ilaha illallah wahdahu la syarika lah. Wa asyhadu anna Muhammadan abduhu wa rasuluh la nabiyya ba'dah amma ba'd. Alhamdulillah, sahabat muslim, ikhwan and akhwat, rahimani wa rahimakumullah. Today's we have a different program. It's different from the previous program because today's morning we have a program in English. Jadi di pagi hari ini kita insyaallah akan mencoba program dalam bahasa Inggris ya sahabat muslim. Nah ini insyaallah bagi sahabat muslim yang sudah biasa ikut program kata dokternya yang biasanya pakai bahasa Indonesia. Nah ini sambil belajar bahasa Inggris kita, asik. Okay, ladies and gentlemen, my dear brothers and sisters, the audiences, the listeners of Radio DFM, we are in program Kata Dokter to this morning with our speaker, Dr. Muhammad John Sp.KJ, and Alhamdulillah, we have connected with our speaker this morning. And our topic for today's program is a book review with title The Psychology of Pandemics. The Psychology of Pandemics. So we have a very interesting topics for today. And we ask the listeners to interact with us here in Radio DFM by contacting us in 0811 6656 876. Ya, 0811 6656 876. So don't forget to contact us for if you have a question and for other discussion about the topics. So we have connected with our speaker. Assalamualaikum, Doctor.
The sound is disrupted.
Oh, the sound.
Can you fix the sound?
Oh, we have something different with internet connection, I think, Doctor. Can you hear me?
Okay. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, all of the audience of the Day FM 87.6. And we would like to discuss about the book review of the Psychology of Pandemics that created by Stephen Taylor. I hope we can take the knowledge about the present situation of today about the COVID-19 and the comparison of the book of the Stephen Taylor that about the psychology of pandemics. And today we have the English session, the English version of the discussion of today, because we want to broaden it in the international community and the national community. So the all of the PowerPoint today for the techniques of the book review of the Taylor about the psychology of pandemics. In these days, the present days, COVID-19 in this world, so we would like to do the comparison about the before the Taylor in the pandemic of psychology of pandemics. We happen. Next slide. Okay. Can you hear me? Yeah. Yeah. The pandemics that by Stephen Taylor that published by the clinicologist in the Department of Psychiatry at the British Columbia, Vancouver, Canada, that wrote this book 2019. Book do not discuss about the COVID-19 because it published before the COVID-19 happened. So we would like to do the comparison between the COVID-19 before today and the pandemics before. Okay, next slide. Next slide. And we also know that the victim of the COVID-19 elaborate about doctors, more than 100 doctors in this COVID-19. The whole of humanity COVID-19. Next. We also know that the infection of this disease could be caused by the droplet or the airborne, about 5 or 6 feet or about 2 meters that could cause by the airborne, and it could cause the death about many billion people that have that in this case of COVID-19. And we have the opportunity, we have the hope about the coronavirus because it will be launched in January 2021, the vaccine of coronavirus. Next. Next slide. Next. Okay. The pandemics, but it was concluded by WHO in 1910. It said pandemics is a large-scale epidemic afflicting millions of people across multiple countries, sometimes spreading throughout the globe. So the pandemics, it could cause the damage to many countries, and it happened in the same day and in the same time. So it could cause the pandemics. We also have the history about the pandemics before the COVID-19. For example, the pandemics of HIV or AIDS in 1981 until present, and the Spanish flu in 1918 and 1920 that could cause the death of 50 billion people that have died in Europe. And the Russian flu, and then the last is the Zika virus pandemic. And we also know about the Hong Kong flu in 1968 and until 1969. We also know that the more of pandemics could happen in this country, in this world, because it was have the pattern how the damage of the virus could cause the spread damage that could paralyze the whole life of these people. Next. Next. And the spread of the COVID-19, we also know that human network between the human or influenza is spread rapidly, inhaled by it's reported by and next. We also know that now we have the regulation of social distancing. Social distancing refers to the intervention, the law of the governor or the people who have power to rule how to maintain the health of the old man in this world by social distancing. We also have known this. Next. Now, about the psychological disorder that happen in the people who suffer in the COVID-19 pandemics. For example, according to Scott and et al. In 2008 and Taylor in 2017, it said most people are resilient to stress, and many survivors of high stressful events will likely emerge psychologically unscathed. Means that the psychological disorder could happen to the people who have suffered by the pandemics. For example, in my practical practice in hospital, it was shown that the anxiety is the #1 that happened that suffer by the people. For example, anxiety of the COVID-19 for the first stressor, and the second is the economic problems that could cause paralyze the economic growth of the country in this area. And we saw also known that the other disorder of the psychological disorder could happen to many people in the all levels, from the president until the major of people in this world. Next slide. Okay, for the first disorder of the case, for example, in the UK, 24% of the community sample reported significant anxiety of the brain. It was swine flu pandemics that happened in the 2009. The anxiety is the third of the UK community sample. And according in a survey of American colleges of the same pandemics, 3% reported at least some degree of anxiety about infected. It's according to Canada and Seller in 2011. So we could get the conclusion that anxiety could cause for the people. For example, in our brain, what happens in our brain when we get anxiety? At the first, the gamma amino acid is increased by the cause of the anxiety, and then the serotonin levels in our brain get lower. So we get anxiety at first, and it happened in the amygdala system that recorded a lot of data, and then it emerged how people could cause the anxiety. Okay, next slide. And the second is the PTSD. According to Schultz and et al. In 28, PTSD, or we could call post-traumatic stress disorder, can be triggered by pandemic-related stressors such as exposure to widespread mortality, and including the deaths and loved ones. And we all know that the brain could happen in this brain because the dopamine, the neurotransmitter dopamine and serotonin could trigger the PTSD, or post-traumatic stress disorder itself. Okay, next. And then the third is depression. Depression, according to the Pettigrew in 1983, it says depression or severe grief can occur in people who have lost loved ones during a pandemic. So we can get the conclusion when we know that our love or our neighbor or our relatives that have dealt in the era of this pandemic, COVID-19, we have sorrow. We have the grief about the problem that happened in this world. And then, according to Taylor in 2017, severe guilt may occur if a person believes they should have saved loved ones. So when we have someone that we love have died in the COVID-19, we have the guilty emotion. Why we could not save him, why we could not save her life or the other. So we have the guilty about our emotion that could cause the depression in the forward times. Okay, next. And then the last is the psychotic disorder. The psychotic disorder is the last for the could cause in the pandemic. survivor, or we all have the suffer from the COVID-19. For example, according to Gardner and Molev in 2015, SARS was also associated with psychotic symptoms during the acute and early recovery phase. So in this history that recorded in 2015 with the SARS pandemic could cause the psychotic disorder. Okay, next. Okay, what happened in the social disturbance in this pandemic record? In the history, it says, according to WHO in 2005, in a 2005 report, the WHO, okay, predicted that widespread panic could occur during the next pandemic if supplies of antiviral drugs are severely limited or ineffective and a suitable vaccine is not yet available. So in this era, we have the hope that the vaccine also still in the preparation of the launch. For example, in this country, maybe according to data of the government, we will have the vaccine COVID-19 will be launched in 2021, about in the month of January. And the other side of this country, in China, it always also has injected the vaccine first, and then the life, and then the social communication in China has been arise. And we still waiting and waiting for about maybe 3 months later about the launch of the vaccine of COVID-19. And I hope we have the panic mass that have the riot or the other people who provocate to do the harmful action that could cause the damage in the social interaction in this country. Okay, next. We also have the hope that I said before that the coronavirus vaccine is developed by a lot of countries according to the data, the Russia, and then China and America, and then the Europe, and then in our country, the Eijkman Institutes in the University of Indonesia in Salemba, Jakarta, also developed the coronavirus vaccine, and we hope that it could release our problem that we have a cure by this vaccine, and we have the antibody to fight the situation of the COVID-19 this time. And also we have, according to the American Psychiatric Association in 2013, injection phobia, also known by the more cumbersome diagnostic label. So in this history of the pandemic, when for example, when the Hong Kong virus also found the vaccine of the Hong Kong virus, many people rejected to be injected by the by the Hong Kong vaccine. But we hope and we have believed that maybe the people in our country will not reject the vaccine of the coronavirus if it will be launched in January 2021, I hope. And then next. Okay, according to the situation of this time, the COVID-19 could cause the decrease of the immunology and could cause the psychosomatis problems. For example, the immunology, our strength, the body to fight the virus could be decreased by the problem of the anxiety. For the first, if we have the severe anxiety about the COVID-19, we will have the lower or lower and lower immunology. When we get the lowest immunology in our body, the virus, the bacteria, and the other system, and then and we hope we have to fight the severe anxiety by doing a lot of things, how to maintain our mental health, and I hope we have to increase our immunology, so we have to fight the virus when they come to infect us. And the last is the psychosomatic disorder. Psychosomatic disorder could happen when very anxiety in this era, when they are very stressful and very anxiety about COVID-19. The problem could cause, for example, the symptoms, the dyspepsia for the stomach, invasion of the heart, the dizziness of your head. It could happen that maybe you could not diagnostic very well about these symptoms, but at last we will found that the psychosomatic had happened to the people who suffer from the COVID-19. Next slide. Okay, that I have talked about the immunology for the previous slide. And next. Okay, and according to the book of the psychology of pandemics, like for example in the Hong Kong flu, swine flu, Russian flu, or the other, it has the pattern, the same pattern in the COVID-19 era. For example, in Hong Kong flu or the swine flu, it said it was the conspiration about two countries. It was the mass biological weapons from China or maybe from the United States. According that record by the history of the pandemics, according to the Stephen Tyler in Psychology of Pandemics, it said the conspiration theory always arises when the pandemics be discussed in the community. For example, in this era of the COVID-19, the theory of conspiration has been discussed also, just like the pattern before in the pandemic in 1 decade before. For example, it was the mass biological weapons from China or maybe the United States, and then the people arguing a lot of logical thinking, but we could not get the conclusion about this conspiration theory. Next. Okay, the effect of the social media. The social media sometimes can provoke a lot of people to do that irrational action. For example, they box information about a lot of things of COVID-19 in the first era, and then now we have a lot of data. Maybe in one day we have read about of hoax data about the social media that could cause the anxiety more severe in our life. Next. Okay, and the last is the effective communication during the pandemic. We discussed both how to conquer save from the problems, and also with the media that support the government how to inform the good information with the proper information. And then from the level of the county and then the governor, it has the a good communication how to give the information to the mass or the community how to save their life. Okay, next. And we also know that the medical staff or the medical practitioner also have the fighting problems in COVID-19. For example, in the present days, we have the data that about more than 100 doctors in Indonesia has been died in the COVID-19 problems. So we also know that all of the medical practitioners must get the surveillance, how they save the life of the people, and they have to save their own self. So in the both side, he has to save the patient life, and the other side, he has to protect himself to get longer for his life. And next. And the tips for according during the pandemic, we have to do the three things that are also said by the government. For the example, use the mask in your mouth. And the second, use the hand sanitizer to clean your hands. And then you must do the social distancing. And social distancing is the most critical points that must do by the people, because in the market and the other public community, a lot of people crowded in one place, so it could cause the spread of the COVID-19 virus. So the rule that been told by the government, we have to do the social distancing, so we could stop the spread of the COVID-19 virus during this pandemic. Next. Okay, next. Okay. Yeah. And the last warning signs to seek help. If we have definitely find out how to get the treatment. For example, you discuss with your, and also finally you could discuss the practitioners, for example, the psychiatrist. Okay, maybe it's enough for PowerPoint, and we could get forward to the questions.
Okay, thank you, Doctor, for the explanation about our topic today. So for the audiences or the listeners, if you have a question regarding to the topic, you can contact us by phone in 0811 6656 876. 0811 6656 876. So Doctor, for the question about the topic, for some people who have psychological disorders due to the pandemics, such as excessive fear or severe anxiety, for some cases, someone said that if I go outside, I'm gonna die, or I just want to stay at home because I don't want to infected by the virus. This is kind of a severe anxiety. So other than finding the vaccine, what kind of psychological treatment appropriate to heal the people who have this kind of psychological disorders?
Okay. According to the data, that the people who suffer from, he will get the severe or maybe phobia, how could not go out from the home, and they care how to meet the people. Maybe he imagined in his brain how the virus could fly, or maybe he imagined how the virus could infect in an easily way. But maybe he consumed a lot of hoax information from the social media, cause the severe anxiety. So at the first, must consume the proper information from the social media. So we could get the proper information release about the anxiety. And the second, we must have the partner to tell our anxiety or our uncomfortable feeling in this situation. When we have the problem, we tell, or maybe we could talk each other between you and your partner. And the last, we have the religion, how the religion in our religion give or protect our life if we, for example, pray at morning, in the morning, for example, Auzubillahi apa? For example, Auzubi kalimatillahi tammati min syarri ma khalaq. Auzubi kalimatillahi tammati min syarri ma khalaq. Auzubi kalimatillahi tammati min syarri ma khalaq. When he said it properly, then he be very in his life. He believed that the God will guide him, will protect him, and everything that happened in this world is also by the license of the God. So when we try to believe the God that in this world we are not alone, we have the God, and we give the tawakal or give the belief to the God totally. And the last the fourth, maybe for the last is we must find or seek the practitioner of the medical psychiatrist. Psychiatrist, for example, doctor or psychiatrist will help you that you have to conquer your anxiety, and then you can do your social adjustment in the forward time in your life. Maybe the 4 tips for the anxiety treatment could help the people who suffer from the COVID-19.
MashaAllah, Jazakallah khair. Thank you very much for the explanation and answer, Doctor, for our topic today. And we ask for Doctor to deliver a summary for our topic today.
Okay, thank you, Mr. Ali. According to the book review of the psychology of pandemics that created by Stephen Taylor, that we have the conclusion the pandemics have the pattern. I repeat, the pandemics have the pattern. I repeat, the pandemics have the pattern. The pattern also could happen in the forward decades after this COVID-19. So when the history has been recorded by the book of psychology of pandemics from the European, the Spanish flu in 1918 until now, the COVID-19 in 2020, the all pandemics has the pattern. The pattern must be learned very, very curiosity and very, very intensive. So we could get the conclusion how to maintain it, how to avoid it, how to conquer it, or how to kill it. So we could get the information in the next decade about the pandemics. We have no idea. We do not know what will happen in the next era. Maybe the pandemics COVID, maybe 22, or maybe the other. We do not know what will happen in the next decade. So in the recording about the pandemics and how we could do the treatment that recorded by the book of psychology of pandemics that created by Stephen Taylor, we can learn, we can get the ibrah about how to maintain our ourselves, how to protect our community, and how we could be safe in the pandemic era. Maybe the old thing about the all that thing that happened in this world, the all must be allowed by the God, by Allah. Maybe that's for the summary of this session.
Thank you very much to Dr. to have delivered the topic for today about the psychology of pandemics. And mashallah, we have a very lot of knowledge for today's topic, and hopefully this knowledge can be useful for us. And today we have a little bit different from the previous program, our audiences, because we deliver our topic in English. And we hope that today's topic will be useful for all the audiences, and we will see you later for the next week in the same time in Kata Dokter. And again, we say thank you to our doctor, Jazakallah khairan. Hopefully this can be amal jariyah for doctor and for us. Hopefully it can be a good knowledge for us. And we close our program today by reciting doa kafaratul majlis. Subhanakallahumma bihamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Wa sallallahu wasallam ala nabiyyina Muhammad. Assalamualaikum warahmatullahi wabarakatuh.